Well, a decubitus ulcer is commonly called a pressure ulcer or a bed sore. National Pressure Ulcer Advisory Panel classifies it as a localized injury to the skin or the underlying tissue over a bony prominence as a result of a pressure in combination with friction or shear. Bony prominences are anywhere on your body that you have a bone fairly close to the surface, such as your hips, your elbows, your knees, your ankles, your heels, your spine, your buttocks if you're laying on your back, tops of your ears, even though that's not a bone, can be very prone to pressure as well. There are 4 stages that are actually staged. Stage 1 is just a redness of the skin that does not blanch. When you push your finger on it, it doesn't turn white and then turn pink again, it just stays red. A stage 2 is a shallow ulceration. Some tissue loss, usually not very deep, usually very shallow, very superficial, but there is tissue gone. A stage 3 is more involved into the subcutaneous and dermis of the skin. Can even be down to the muscles sometimes, depending on what bony prominence it is, because obviously over the nose is a lot shallower skin than over, say, over the hip or the knee or the buttock. A stage 4 usually involves muscle and bone is visible. There's also one that's called an unstageable, and that is where there's eschar covering the surface of the wound, or slough, or a big scab for lay people that's covering the surface of the wound, and we can't see what's underneath that wound. So we call those an unstageable. Another one that they use is called a deep tissue injury, and that's a purpling. It looks like a bruise. It starts as a bruise, but it's over a bony prominence. Not just a bruise in the middle of your thigh, but a bruise on your knee or on your heel or on your hip or your buttock, where it would be a bony prominence that's causing tissue underneath. Those are typically caused by shear. Friction and shear are 2 other main causes of decubitus ulcers other than pressure. Pressure itself is probably the primary #1 reason. Friction is just the force of dragging skin or dragging a person up in bed or shifting themselves out of a couch or a chair to get up, not using the lift mechanism of their lift chair and scooting themselves out. And that's just that surface abrasion. Looks like a rug burn, what people would call a rug burn, or looks like just a tiny little bruise or burn to the skin. Shear is actually underneath the surface of the skin. It's where the epidermis and dermis kind of separate, and the 2 separate, so maybe the pelvic bone will go one direction but the skin goes another direction. And that's internal. It's not visible on the surface of the skin, but it's one of the primary causes for deep tissue injuries and pressure ulcers. Quicker the treatment, the better. If it's not something that you think you can take care of yourself, definitely seek assistance from your primary care provider. Sometimes it results in a referral to me. We can look at all of our options as far as what do we need to use for wound healing, what do we need to do to reduce pressure, do we need to do that pressure mapping, moisturization of their skin. Again, I can't stress that enough as far as internally taking enough liquids during the course of the day for hydration and applying some type of moisturizer on a regular basis. Frequent skin assessments if you have a loved one that's somewhat immobile. Someone that's not able to check themselves. It's, you can't see your own bottom, so it's hard to tell. But just frequent assessments to make sure that things are doing okay.